We continue with food organs. This time we discuss large intestine, urinary bladder, and the triple jaw. The large intestine is connected with the small intestine at the ileocecal valve in the upper part and the anus in the lower part. It has the exterior-interior relationship with the lung. Physiological functions: transforms and conveys the waste, reabsorbs redundant water. The large intestine receives the waste of food transmitted down from the small intestine. After absorbing part of the water from the waste, the large intestine transmits the waste downward and transforms it into stool to be excreted from the anus. Dysfunction of large intestine may lead to diarrhea, purulent blood in stool, bad breath, abdominal distension, or constipation. Since the large intestine reabsorbs the redundant water from the food residue, there is a saying: the large intestine dominates thin fluid. If food residue remains in the large intestine for a minimal time, diarrhea may occur, eventually causing constipation. The urinary bladder's upper outlet connects to the kidneys through the ureters, while its lower outlet connects with the urethra. The urinary bladder has exterior-interior relationship with the kidney. Physiological functions: stores urine, discharges urine. The urine is produced by kidney qi transformation and is stored in the urinary bladder. Therefore, the function of the urinary bladder depends on the functions of kidney. If kidney yang is deficient, the bladder will close and open abnormally. It will result in profuse night urination, enuresis, and incontinence of urine. Urine can be excreted naturally out of the body through qi-transforming function of the kidney and the urinary bladder. If the kidney and the bladder lose their functions, it will lead to dripping urination, incontinence of urine, anuria, frequent urination, urgent urination, and potinuria. Usually, acute micturition disorders are related to urinary bladder, while chronic cases are related to the kidney. The triple jaw refers to the upper jaw, middle jaw, and lower jaw. It belongs to one of the four organs. No organ has close relationship with triple jaw. Concept: the triple jaw belongs to one of the four organs. Affiliation: the upper jaw would be heart, lung, and above diaphragm. Middle jaw, spleen, stomach, liver, gallbladder, below diaphragm and above the navel. The lower jaw, kidney, urinary bladder, small intestine, large intestine, below the navel. Total physiological functions: the passageway for the transformation of primordial qi and fluids. Upper jaw is like mist, middle jaw is like foam, lower jaw is like ditch. Total physiological functions: opening the passage for primordial qi. The triple jaw is the passageway for the primordial qi, which is distributed to all parts of the body to nourish tissues and promote the physiological functions of viscera. Moreover, the function of the triple jaw is to affect the whole body's function of qi movement and qi transformation. Therefore, there is a saying: the triple jaw governs the whole body qi, as well as controls qi movement and qi transformation. Letter B, transporting body fluids. The triple jaw is a major passageway of fluid distribution and excretion. Obstruction of triple jaw may affect functions of the lung, spleen, and kidney, leading to phlegm and edema. The respective physiological functions of the triple jaw. A, the upper jaw is like a mist. The chest area above the diaphragm is the upper jaw, which includes heart and lung. The upper jaw distributes qi, blood, and body fluids to the heart, lungs, and head, just like fog permeating everywhere. The middle jaw is like a foam. The middle jaw refers to upper abdominal areas below the diaphragm and above the navel. It includes spleen, stomach, liver, and gallbladder. The middle jaw has the function of digestion, absorption, and distribution of food essence to produce qi and blood. The lower jaw is like a ditch. The lower jaw refers to lower abdominal areas below the navel. It includes the kidney, the urinary bladder, and intestines. The lower jaw excretes waste like drainage. Thank you so much for listening.
Let's proceed to interviewing. And discuss about the eyes. Although the eyes are nourished and moistened by liver blood and liver yin, there are many other factors that affect the eyes. Several channels emerge or terminate in the area of the eyes. The eyes can be disturbed by both exogenous and internally generated pathogenic qi. Heat in particular can disturb the eyes. The eyes are physically located in one of the most yang areas of the body, and heat will always rise upwards due to its yang nature. This means that if there is internally generated heat, such as stomach or liver fire, the heat can rise upwards, resulting in red, stinging, or itchy eyes. Invasions of wind heat can also result in red and stinging eyes. This is typical of conjunctivitis and hay fever. Ascending liver yang and liver fire can also force an excess of qi up to the area. This will cause pain and pressure either behind or in the eyes. The increased amount of qi can also disturb the vision. Phlegm can lead to there being a sensation of heaviness in and around the eyes. It can also block blood and yin from nourishing the eyes. This will result in visual disturbances. Liver blood deficiency will also mean that the eyes lack nourishment. The eyes will feel dry and the vision will be poorer. The person may have difficulty focusing or there may be spots in front of the eyes. These symptoms will be exacerbated by fatigue, and liver blood deficiency can manifest with a sensitivity to bright light or poor nocturnal vision. If a person is liver yin deficient, their eyes will also feel dry because they are not moistened by yin. Tears are a body fluid that is directly influenced by the liver, according to the theories of the five phases. This means that liver imbalances can manifest with the eyes watering, especially when it is windy. Wind itself also has an adverse effect on the liver. As with other eye disorders, watering eyes can be a deficient or an excess condition. Invasions of wind heat and wind cold can often cause the eyes to water. This is because the exogenous pathogenic qi will disrupt the lung and cause the lung qi to become rebellious. The rebellious lung qi will force the fluids that have accumulated in the lung to ascend to the eyes. Itchy eyes can arise when there is not enough yin or blood to nourish the eyes or when heat rises upwards or invades from the exterior. So to summarize the eye symptoms and their significance. If the eyes are red and possibly with swelling and pain, it would indicate wind heat, toxic fire, liver fire, or stomach fire. If the eyes are dry, it could mean kidney and liver yin deficiency. If there is blurring of vision, spots or floaters in front of the eyes, it could mean blood deficiency. If there are visual disturbances, then it would indicate liver blood deficiency, liver yin deficiency, liver fire, ascending liver yang, or phlegm. If there is pressure behind the eyes or feeling of pressure inside the eyes, it means ascending liver yang or liver fire. If there is sensitivity to bright light, it means there is blood deficiency. If there is poor night vision, it also means blood deficiency. There is watering of the eyes, particularly when it is windy. It means liver imbalance, invasions of wind cold, or wind heat. The eyes are itchy, to be due to liver yin deficiency, liver blood deficiency, liver fire, stomach fire, heart fire, or wind heat. The eyes are the orifice of the liver, but this does not mean that all eye problems are related to the liver. In fact, other organs affect the eyes, and notable among these are the heart, kidneys, and gallbladder. The heart influences the eyes as both its main and connecting channels go to the eyeballs. For this reason, many eye problems are due to heart heat deriving from emotional problems. The kidneys nourish and moisten the eyes in a manner similar to the liver, and eye problems in the elderly are very frequently due to a kidney deficiency. The gallbladder channel also goes through the eyes and may cause eye problems, usually in conjunction with liver fire or liver yang rising. So why do we ask about the eyes? The questions regarding the eyes are somewhat more important than those regarding the ears. First, because eye problems are more common, and second, because some eye symptoms often clinch a diagnosis. For example, the symptoms of dry eyes often clinches the diagnosis of liver iron deficiency, although it may be caused by kidney iron deficiency too. So when do we ask these questions? We usually ask about eye symptoms early during the interrogation in conjunction with questions aimed at identifying a particular pattern. For example, if a patient displays symptoms of liver blood deficiency, we would ask about blurred vision and floaters immediately. We'd also then ask about dry eyes, progress to a deeper level of liver yield deficiency. Questions regarding blurred vision, floaters, dry eyes, and red, painful, itchy eyes are important, and we ask them in nearly every case. How do we ask these questions? Blurred vision is not an expression most patients are familiar with. We generally ask them whether their vision is sometimes not clear or sometimes obfuscated, stressing that the condition at issue is quite apart from their being short-sighted or not. Floaters is another expression most patients are not familiar with, and we generally ask whether they ever see black or white spots floating in the field of vision. Thank you for listening.
Let us talk about Yangshen. In Chinese culture, there is a concept called Yangshen to nurture life. Yangshen includes all the possible physical and spiritual practices that can be utilized to strengthen and nourish not only the physical body but also the Shen. Yangshen includes everything from dietary principles, various forms of exercise such as Qigong and Tai Chi, and meditation techniques to diverse sexual practices. Yangshen is relevant to us as practitioners of Chinese medicine in the West, as there is a concept in Chinese medicine that is summarized in the saying, 7 parts care and 3 parts treatment. Care in this context denotes dietary and lifestyle changes. For a patient to get the maximum effect from an acupuncture, a Chinese medicine herbal treatment, it is important that the patient supports their treatment through dietary and lifestyle changes. This is because their patterns of imbalance have not arisen by themselves, but are the consequence of various etiological factors. Many patterns of imbalance emerge directly and indirectly from dietary factors and through either too much or too little or incorrect exercise. Furthermore, although diet and exercise were not directly involved in the creation of the imbalances, they can often be used to influence the body in a positive direction. The best results will be achieved if the patient addresses the factors that are helping to create or aggravate their patterns of imbalance. We can treat the patient with as many needles and elegant point combinations as we like, but if the patient does not address the root cause of their imbalances, the imbalances will often just regenerate themselves. It is not uncommon that it is only when a patient begins to comply with the advice that they have been given that there is significance and lasting change in their condition. Often the greatest help that we can give our patient is to give them the tools to heal themselves. This can be acupuncture points that they can press on or treat themselves with moxa, or it can be advice with regard to diet, exercise, relaxation, meditation, or breathing exercises. By giving the right advice to each individual patient, we can give this person the power to take control of their own life so that they control their patterns of imbalance and their patterns of imbalance do not control them. To some people, this might sound as if they thereby erode our own economic foundation as a therapist. First, our primary motivation as therapists should always be to help others in the most effective way possible and should not be financially determined. Second, you will achieve quicker and better results when the patient cooperates and make changes in the factors contributing to their problem. Patients who get well, particularly patients who get well quickly, are the best advertising you can get as a therapist. Nutrition and lifestyle recommendations are only effective if the patient puts the recommendations into practice. Even the very best advice will have absolutely no effect if the patient does not follow these recommendations. In fact, advice that is not put into practice can quickly turn into a guilty conscience, which can itself become an ideological factor that creates new or exacerbates existing patterns of imbalance in the patient. There can be many reasons why patients have difficulty complying with the recommendations you give them. Let's say lack of time and energy. This is especially relevant in relation to things such as exercise, meditation, and dietary changes that involve the preparation of food in a different way. Many people ought to be able to find time during the day to meditate for 20 minutes, but the spare time that they do have is often consumed by Facebook, watching television, playing games on their smartphone, and so on. However, there are people who literally do not have any free time due to the pressures of work, family, and other obligations. This means that you should be realistic in the recommendations that you give them. At the same time, it is often important that precisely these people do try and create a space for themselves in their lives. This is because you can hear that these people are constantly active, constantly yang. These people have an even greater need to have some time while they are awake, where they are in a more yin state. When people find it difficult to find time during the day to meditate, practice Qigong, or do something similar, you can suggest that they get up 20 minutes earlier each day. Even though they lose a little sleep, the benefit that they receive from the meditation, Qigong, and so on will often more than offset the loss of sleep. Exercise can also be integrated in the daily routine of people whose time is limited. You can suggest that they bike to work instead of taking the bus or driving, or that they take the stairs instead of using the elevator. Other people do actually have the time, but they do not use it ideally. These people need to have more self-discipline, and this may require stricter words from the therapist. Finally, you can also remind people who say that they are too busy to meditate of the Zen proverb, everyone should meditate for 20 minutes each day, except those who are too busy. They should meditate for 1 hour. Thank you so much for your attention.
Diagnosis according to 4 levels. This time we take up blood heat generating wind. The extreme heat and injuring of yin and blood in the liver can result in the liver causing wind to begin to stir. This can manifest as febrile convulsions, muscle spasms and tremors, dizziness, and neck stiffness. The ascending heat from the liver can cause headaches, red eyes, upwardly staring eyes, the person grinding their teeth, and irritability. The heat will also result in fever and thirst. But etiology, pathogenic qi that has penetrated from the qi or yin level. Symptoms and signs, convulsions, stiffness of the neck, muscle spasms and tremors, grinding teeth, headache, dizziness, red eyes, the eyes may stare upwards, irritability, mania, fever, thirst, dark red tongue without coating, rapid, fine, or wiry pulse. Key symptoms are fever, cramps, stiffness in the neck, dark red tongue, and rapid pulse. Treatment principle, drain blood and calm wind. The person will probably be in intensive medical care. If this is not possible, or while waiting, you can choose from the following points. Jingwell points, Sichuan, which is an extra point, bladder 62, SI3, spleen 10, LI 11, liver 2, liver 3, GB 20, DO 16, and DO 20. Needle technique, draining, bleed, Jingwell, and Sichuan points. Jingwell, Sichuan points, and LI11 will drain the heat. Liver 2 and liver 3 drain heat from the liver and calm wind. GB20, DO 16, and DO 20 descend yang and calm wind. The person will probably be in intensive medical care. Blood heat generating wind can be caused by qi level heat and yin level heat, and this can result in yin and blood deficiency. Thank you very much for your attention.
Let's discuss treatment principles with 2 treatment methods, blood regulation and astringency or consolidation. First, let's discuss blood regulation. This method of treatment is intended for resolving blood stasis and correcting abnormal blood flow. It has 2 applications. First, to mobilize the blood. This is the method's basic application and is suitable for any condition in which blood flow is impeded or static or the meridians are obstructed. Second application, to stop bleeding. In Chinese medicine, bleeding occurs when circulation is so disturbed that blood flows abnormally out of its normal channels. This method is applicable to such conditions as hemoptysis, epistaxis, hematemesis, hematochezia, and hematuria. If qi is impeded, blood becomes static. When qi moves, blood flows. Thus, when treating blood stasis or impedance, it is wise to combine blood mobilization with qi regulation. When blood is warm, it circulates more vigorously. When blood is cooled, its circulation becomes sluggish. Use the method of blood regulation with warming of the meridians to enhance its ability to mobilize blood and remove blood stasis. Mobilization of blood and removal of stasis should be avoided during pregnancy. Bleeding may be due to heat causing blood to flow wildly or to qi being unable to control blood. In the former, the appropriate treatment is to cool blood to stop the wild flow. In the latter, the appropriate treatment is to augment qi to enhance its command of blood. When treating bleeding, it is important not to leave residual static blood to cause further impedance. Except for sudden massive blood loss, when stopping the bleeding is the first and urgent priority, the treatment to stop bleeding should, in general, use some herbs that mobilize blood and dissolve static blood. This is more effective in stopping bleeding without leaving behind any static blood. Now let's go to astringency or consolidation. This method uses astringency, consolidation, or pulling back to stop improper seepage or leakage. It has the following application. First, perspiration. This method astringences the exterior and stops sweating. It is designed for an insecure exterior with excessive sweating and is effective in both spontaneous sweating and night sweating. Second application, for diarrhea. This method is most suitable for treating chronic diarrhea with incontinence due to deficiency of spleen yang and kidney yang. Third application, spermaturia and urinary incontinence. Astringency is an effective treatment for deficiency of kidney qi, which causes spermaturia or premature ejaculation or urinary incontinence and polyuria. This method is designed for failure to hold back due to deficiency of genuine qi. It is not suitable for sweating or in illnesses of heat, for the early stages of the dysentery caused by exogenous agents, for diarrhea caused by improper diet, or for spermaturia due to other causes. This is not a method to treat the root, so it is important to continue searching for the cause of the illness. For example, in spontaneous sweating due to yang deficiency, the proper approach to treatment is to augment qi while astringing the sweating. In night sweating due to yin deficiency, the proper approach to treatment is to nourish yin while astringing the sweating. Thank you for your attention.
Let's go to diagnosis according to Zhangfu organ patterns. This time is spleen qi not holding blood inside the vessels. Spleen qi not holding blood inside the vessels is again a variation of spleen qi deficiency. In this pattern, the spleen is not able to perform its function of keeping blood inside the vessels. This will manifest in bleeding and bruising. The bleeding can take many forms. It may be different kinds of menstrual disorders, such as mid-cycle spotting, heavy menstrual bleeding, or prolonged menstrual bleeding. Or there may be nosebleeds, blood in the urine, or blood in the stools. It is, however, important to remember that spleen qi not holding blood inside the vessels is just one of several patterns that can result in bleeding. Bleeding can also occur when there is deficiency or excess heat and when there is blood stagnation. There will usually be a combination of more than one pattern at a time. Furthermore, it is important to remember that these patterns will lead to the development of blood deficiency over time. Milder cases of spleen qi not holding blood inside the vessels are seen in people who have a tendency to bruise easily. The etiology of this pattern is identical to that of spleen qi deficiency, where symptoms and signs are heavy or prolonged menstrual bleeding, spotting or bleeding in the middle of the menstrual cycle, blood in the urine, blood in the stool, nosebleeds, a tendency to bruise easily, fatigue, loose stools, craving sweet flavors, weakness or fatigue in the limbs, pale complexion, pale tongue, weak or fine pulse, especially in the right guan position. The key symptoms is bleeding, fatigue, pale tongue, and weak pulse. The treatment principle is tonify spleen qi and astringe the vessels. And the acupuncture points to choose from are stomach 36, spleen 1, spleen 3, spleen 6, spleen 10, kidney 8, ren 12, bladder 17, bladder 20, and bladder 21. With the needling technique of tonifying, and moxa can be used on all points and must be used on spleen 1. The explanation for the points is that stomach 36, spleen 3, spleen 6, ren 12, bladder 20, and bladder 21 tonify spleen qi. Spleen 10 stops bleeding, spleen 1 with moxa stops bleeding as well, and kidney 8 stops uterine bleeding, and urinary bladder 17 nourishes blood. The advice given in this section on spleen qi is also relevant here. Spleen qi not holding blood inside the vessels can be caused by spleen qi deficiency, spleen yang deficiency, spleen qi sinking, and kidney yang deficiency. And the result can be blood stagnation, blood deficiency, and yin deficiency. Let's look at the summary of spleen failing to manage the blood. The etiology is excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, the diet lacking in protein, excessive mental activity, prolonged exposure to damp, and chronic illness. The underlying or accompanying pathology is spleen qi deficiency. The signs and symptoms are poor appetite, slight abdominal distension after food, tiredness, weakness of limbs, pale and sallow complexion, weak and fatigued spirit, loose stools, tendency to obesity, petechiae, blood in urine or stools, excessive uterine bleeding, dizziness, heart palpitations, shortness of breath, and the pulse is weak or fine, and the tongue pale. Treatment principle is to boost qi to contain blood. Acupuncture treatments are ren 12 that supplements stomach and spleen. The spleen 3 is a source point of the spleen. Bladder 20 supplements spleen qi, especially in chronic cases. Du 20 raises yang and nourishes the marrow. Bladder 17 nourishes and harmonizes blood. Spleen 1 strengthens the spleen and stops uterine bleeding. Stomach 36 supplements spleen qi. Spleen 6 supplements spleen qi as well. And bladder 21 supplements stomach and spleen qi. Ren 6 regulates qi, harmonizes blood, and spleen 10 helps spleen manage the blood. Needle with supplementation of moxa. For blood in the stool, you may use Ren 4 and bladder 35. And for flooding or spotting, use Ren 4 and Ren 6. Thank you so much for your attention.
We talk about qi, concept, formation, physiological actions. Essence, qi, blood, and body fluids are among the basic substances that constitute the human body. They are also the basic substances for maintaining its vital activities, and in turn, they are the products of metabolism by the viscera. Both physiologically and pathologically, there is a reciprocal causal relationship between essence, qi, blood and body fluids on the one hand, and the viscera, tissues, and meridians on the other. Consequently, they are of major importance in guiding the clinical analysis of symptoms and therapeutics. In ancient China, qi represented a simple understanding of natural phenomena. Already during the spring, autumn, and the warring states eras, philosophers held that qi was the most basic substance that constituted the world and that everything in the world was produced by the action of qi. This conception was introduced into medical theory and became a fundamental tenet for explaining the vital activities of the human body. Today, qi is conserved as the most basic substances that constitute the human body and maintain its vital activities. In order to sustain the vital activities, the body needs to extract nutritive substances from the environment to replenish qi in the zhang viscera. Without qi, this viscera would simply cease to function. The formation of qi is a very involved process in which a number of zhangfu viscera play important parts. Qi in the human body comes from three sources: Innate essential qi is inherited from parents. Essential qi is derived from essence of drink and food, transported and transformed by the spleen and stomach, and clear qi, fresh air, is inhaled by the lung from the natural world. It is clear that the formation of qi is not only related to innate inheritance, acquired nutrition, and condition of the environment, but also closely related to the kidney, the spleen, the stomach, and the lung. When the functions of these internal organs are normal, qi in the body is replete. Conversely, if they function abnormally, the actions of qi will be affected and the pathological changes such as qi deficiency may ensue. Qi is the basis for the maintenance of the body's vital activities. It has many different actions. In general, these actions may be grouped in the following 5 categories. First is promoting action. Qi belongs to Yang and is full of vigor. It can propel the circulation of blood and the distribution and metabolism of body fluids. Simultaneously, it can also stimulate the physiological functions of the Zanfu viscera and the meridian so that the viscera can continue to produce new qi, blood, and body fluids to meet the needs of growth and development of the body. Any reduction in this motive force of qi can lead to diminished function of the Zanfu viscera, resulting in disordered and uneven blood circulation or disordered water metabolism. Second, warming action. This refers mainly to the warming and evaporative actions of Yang Qi. The maintenance of the body's normal temperature, the physiological activities of all the organs and tissues, and the normal movement of blood and fluids all depend upon Qi's warming action. Deficiency of Qi, especially Yang Qi, will lead not only to such cold symptoms as cold aversion, preference for warmth, cold limbs, and low body temperature, but also to slower blood circulation and disturbances of fluid metabolism. 3. Defending action. This action is demonstrated mainly in 2 aspects. One is to defend the body surface against attack by exogenous evils. The other is to combat exogenous evils that have penetrated the body's defenses and to expel them from the body. When the defending action of the body is strong, the person is less likely to suffer from illnesses. And should the person become ill, the illness is more readily treated. But if the defensive capability is weakened, the body is more susceptible to attack by pathogenic evils, and any illness is more difficult to treat. Fourth, stabilizing action. By these functions, qi stabilizes the liquid systems of the body, preventing the liquids from flowing out of their vessels without cause. It is marked by the actions of keeping the blood flowing in the vessels and of controlling the amount of the secretion or excretion of sweat, urine, saliva, gastric juice, intestinal juices, and semen, so as to prevent their abnormal loss. Failure to control blood flow in the vessels may result in bleeding. Failure to control body fluids may cause spontaneous perspiration, polyuria, or excessive salivation. Failure to stabilize sperm may lead to spermaturia or premature ejaculation. By this function, qi also maintains the internal organs in their designated locations. Failure in this action may lead to their ptosis or prolapse. And finally, the 5th one is transforming action. This refers to the various kinds of changes in the body induced by the movement of qi. Mostly, it encompasses such actions as the metabolism of essence, blood, and body fluids, and their transformation into one another. For example, essential substances are extracted from food and drink, and these are transformed into essential qi. Essential qi, in turn, is transformed into qi, blood, or fluids. Metabolism of the fluids further transforms them into sweat or urine and the wastes. These are all effects of the transforming action of qi. If this function is disturbed, it may affect the turnover of qi and blood, the metabolism of body fluids, the digestion of food and drink, the absorption of essential nutrients from them, the excretion of sweat and urine, and the defecation of feces. Disturbances in these processes can result in many kinds of illnesses. Thank you for listening.
Let's now discuss diarrhea and its Western differentiation. In Western medicine, diarrhea is defined as the passage of 3 or more loose or liquid stools per day, or an increase in the number or volume of bowel movements. Acute diarrhea starts suddenly and lasts less than 14 days, whereas chronic or persistent diarrhea is defined as a symptom that lasts longer. From a pathophysiological perspective, diarrhea may be subdivided into osmotic, secretory, inflammatory, and motility related. The causes of acute diarrhea. Major causes of acute diarrhea include various viruses like the rotavirus, bacteria like the Salmonella, Escherichia coli, and parasites like Giardia lamblia, which can cause gastrointestinal infections. In addition, it may result from ingestion of toxins, use of drugs like antibiotics and chemotherapy medicines, inflammatory conditions such as appendicitis, and mesenteric ischemia. The most common causes of chronic diarrhea are irritable bowel syndrome, celiac disease, chronic inflammatory bowel diseases such as Crohn's disease and ulcerative colitis, and neoplasm. In more recent years, immunosuppression-specific conditions may also be a cause. Let's talk about Crohn's disease. This is a type of chronic inflammatory bowel disease which can affect the entire digestive tract, from the mouth to the anus, although it usually affects the last part of the small intestine or the ileum, and some of the large intestine or colon. Its main manifestations are diarrhea and abdominal pain with stools, which may rarely contain mucus and blood. Complications include stenosis and or fistulae. From the point of view of Chinese medicine, this condition often corresponds to damp heat in the intestines. Next, let's talk about ulcerative colitis. This is characterized by ulceration of the large intestine, primarily the rectum. The main clinical manifestation include diarrhea with blood and mucus in the stools and abdominal pain. From the Chinese point of view, this condition often corresponds to damp heat and stasis of blood in the intestines. Toxic megacolon may be a complication of ulcerative colitis. Next, we have irritable bowel syndrome. This term is usually used in Western medicine in all cases of abdominal pain and alternation of diarrhea and constipation, which no abnormality may be found on sigmoidoscopy, colonoscopy, or barium enema. Being a functional disorder, many clinicians approach irritable bowel syndrome as a diagnosis of exclusion. The clinical manifestation include abdominal pain and distension and diarrhea, which often alternates with constipation. From a Chinese perspective, this condition often corresponds to stagnant liver qi invading the spleen. In neoplasm, this is a malignant cancer of the colon or rectum, which may cause diarrhea. This would be accompanied by abdominal pain. A red flag in Western medicine, special attention should be paid to acute diarrhea with bloody, as in dysentery, and or black tarry stool similar to coffee grounds. This condition requires immediate medical attention and diagnosis. Thank you for your attention.